Lung cancer is one of the most dangerous and common diseases worldwide. Early detection of symptoms can help save lives. However, the symptoms of lung cancer are often vague and can be confused with other conditions like the flu, pneumonia, or bronchitis. Therefore, recognizing early warning signs is crucial. Persistent or sudden change in coughing. Persistent coughing is one of the earliest symptoms of lung cancer. If you have a cough that lasts for more than 3 weeks without any clear reason, it could be a sign of lung cancer. It is also important to pay attention when the cough suddenly changes in intensity or type, such as a dry cough, a cough with phlegm, or coughing up blood. Coughing is a natural reflex of the body to clear debris from the respiratory tract. However, when the cough persists and has no clear cause, it may be a sign of something more serious. As lung cancer progresses, the tumor in the lungs can irritate the airways, leading to coughing. The cough may worsen at night or with changes in weather. Shortness of breath and wheezing. Shortness of breath and wheezing are common symptoms when lung cancer has progressed. Patients may feel short of breath, even without strenuous activity, or wheezing when inhaling or exhaling. This occurs because the tumor in the lung may block airways, making breathing difficult. Shortness of breath can develop gradually, especially when the tumor grows larger and starts to obstruct the airflow in and out of the lungs. Patients may also feel fatigued and weak due to the lack of oxygen in the body. Wheezing is a sound produced when air passes through narrowed or blocked airways. If you experience this symptom, it is important to consult a doctor for timely examination. Chest pain or feeling of heaviness. Chest pain can be a symptom of lung cancer, especially when the tumor has grown large or spread beyond the lungs. A feeling of pain or heaviness in the chest may occur when taking deep breaths or coughing. In some cases, the pain may radiate to the back or shoulders. Chest pain can be a symptom of lung cancer, especially when the tumor has grown large or spread beyond the lungs. A feeling of pain or heaviness in the chest may occur when taking deep breaths or coughing. In some cases, the pain may radiate to the back or shoulders. Fatigue and weakness. Chronic fatigue and weakness are among the early symptoms of lung cancer, especially when the tumor has spread. The fatigue does not go away even with adequate rest. Patients may feel too weak to perform daily activities. Fatigue can be a distressing symptom that significantly impacts the patient's quality of life. The exhaustion caused by lung cancer is a sign that the body is dealing with a serious condition. This fatigue may worsen if the patient does not receive timely treatment. Sudden weight loss without explanation. Unexplained sudden weight loss is a warning sign for many types of cancer, including lung cancer. If you experience unusual weight loss without any changes in diet or physical activity, it could be a sign of lung cancer. As the tumor in the lungs grows, the body uses more energy to fight the illness. This can lead to weight loss without any clear reason. Uncontrolled weight loss can be a sign of overall health deterioration, especially when it is accompanied by other symptoms such as fatigue or loss of appetite. Coughing up blood. Coughing up blood is a concerning symptom and may be a sign of lung cancer. Even small amounts of blood should not be ignored. Coughing up blood can occur when blood vessels in the lungs rupture due to the tumor's effects. As the tumor grows in the lungs, it can invade small blood vessels in the lungs, causing bleeding. Bleeding in the lungs may result in coughing up blood or even blood in the phlegm when coughing. This is a serious symptom and requires timely examination to determine the cause and provide treatment options. Difficulty swallowing or hoarseness. Difficulty swallowing or hoarseness can be signs of lung cancer when the tumor affects the nerves controlling swallowing or speech. This often happens when lung cancer has spread to the neck or nearby lymph nodes. When lung cancer spreads, it can cause changes in swallowing ability or make the voice become hoarse or weak. This can make eating and speaking difficult, impacting the patient's quality of life. If you experience this symptom, you should see a doctor to determine the cause. 8. Changes in bowel habits. Although not a common symptom, changes in bowel habits such as constipation, diarrhea, or blood in stools can be a sign of lung cancer, particularly when the cancer has spread to other organs. When lung cancer spreads, cancer cells can move through the lymphatic system and bloodstream, affecting other organs such as the liver, bones, and digestive system. Changes in bowel habits can be a sign that cancer has metastasized, and if you notice such symptoms, you should seek medical attention immediately. Risk factors for lung cancer. Several factors can increase the risk of developing lung cancer, including smoking. This is the biggest and most significant risk factor for lung cancer. Smoking increases the risk of developing lung cancer many times over compared to non-smokers. Family history. People with a family history of lung cancer are at higher risk. If you have a family history of lung cancer, you should be more vigilant about symptoms and undergo regular checkups. Exposure to harmful chemicals. People working in environments with exposure to harmful substances such as asbestos, industrial smoke, or other chemicals are at higher risk for lung cancer. Exposure to radon. Radon is a radioactive gas that can be found in homes and living environments. Prolonged exposure to radon can increase the risk of lung cancer. Treatment for lung cancer. Treatment for lung cancer depends on the stage of the disease, the type of cancer, and the overall health of the patient. Main treatment methods include surgery. If lung cancer is detected in its early stages, surgery may be performed to remove the tumor and part of the lung. Radiotherapy. This involves using high-energy X-rays to destroy cancer cells. Radiotherapy may be recommended when the cancer cannot be surgically removed or when the patient is not fit for surgery. Chemotherapy. This method uses drugs to kill cancer cells. Chemotherapy may be used to treat advanced lung cancer or when cancer has spread. Targeted therapy. This involves using drugs that target specific factors that help cancer cells grow. Immunotherapy. This stimulates the body's immune system to help fight cancer cells. In conclusion, although lung cancer is a dangerous disease, identifying early warning symptoms and having regular health checkups can help us proactively manage the disease and increase the chances of effective treatment. Always pay attention to your health, and don't hesitate to seek medical help if you notice any unusual signs. If you found this information useful, please share it with others to raise awareness and help more people take action early.